Hello everyone, my name is Raoul Concepcion. I'm a practicing urologist in Nashville, Tennessee, specializing in urologic oncology, and I'm also the Director of Clinical Research at Urology Associates. I'm also the immediate past president of the large urology group Practice Association, also known as LUGPA. I have the privilege today of moderating a panel discussion on managing prostate cancer patients effectively in a urology practice setting. Our goal for today is to provide urologists with a range of expert perspectives about the current issues in both urology practice management and effective care of patients with urologic cancers. We'll discuss practice management and then delve into screening and treatment of prostate cancer in the second part of our session. In the first part, we'll discuss practice management models and logistics for effective cancer care in the setting of today's changing world of healthcare. We'll focus on topics such as balancing cost with quality care, effective models for treatment reimbursement, and integrating bone health clinics into a urology practice. The second part of this video series delves into the care of patients with prostate cancer, talking specifically about screening controversies, the changing treatment landscape of prostate cancer, and prevention and management of skeletal-related events. These topics, as well as many others that address the clinical and practical issues urologists face in treating patients with cancer, are explored in the new publication of which I am the editor, Urologists in Cancer Care. Several of today's panelists are also members of the magazine's editorial advisory board. For today's panel, I'm joined by 4 leading experts and frontline practitioners who will address both the challenges of practice management and the evolving landscape of the diagnosis and treatment of prostate cancer from the urologist's perspective. Dr. Mark Austenfeld is a practicing urologist at Kansas City Urology Care and at St. Luke's Hospital in Kansas City, Missouri. Mark's focus is on reconstructive surgery and treatment of urologic cancers. Dr. Austenfeld is also the president-elect of the American Association of Clinical Urologists. Dr. E. David Crawford is a urologic, oncology, and prostate cancer expert who is heavily involved in prostate cancer research. He is professor of surgery, urology, and radiation oncology, the E. David Crawford Endowed Chair in Urologic Oncology, and the head of the Urologic Oncology at the University of Colorado Health Science Services in Denver. Dr. Paul Sieber is a practicing urologist at Lancaster Urology in Lancaster, Pennsylvania. Dr. Sieber coordinates clinical trials for the group and has been involved in clinical trials for over 10 years. He serves on the editorial board of Urologists in Cancer Care. We're also joined by Dr. Neal D, a practicing clinical urologist and medical director at the Carolina Urologic Research Center in Myrtle Beach, South Carolina. Dr. Shore specializes in oncologic and surgical urology, including clinical trial management in the community setting. Dr. Shore also serves on the board of directors of the large urology group Practice Association, or LUGPA, and the National Cancer Institute's Genitourinary Scientific Steering Committee, and serves on the editorial board of Urologists in Cancer Care. Thank you for all for joining us today. Let's go ahead and get started.